Hi, and welcome to another edition of Your Health with Dr. Christy. My name's Dr. Christy Reisinger, and today I'd like to talk about 4 reasons why we should start school in the fall. The first reason is that it's thought that children may not be infected with COVID-19 as easily, or those that are infected have very mild symptoms or are completely asymptomatic, meaning that they have no symptoms at all. Some data behind this is that as of April 2nd, 2020, on the CDC website, among 149,000 people for which their age was known, only 1.7%, or 2,572 people, of those with COVID-19 were in children ages less than 18. Another interesting study is in a small Italian town of Vo, where they have 3,300 people. They tested everyone in the city, and of the 374 children in that town, there were no children that tested positive for COVID-19 under the age of 10, despite having a positive rate of 2.4% in the general population of all ages. The second reason is that children are thought to have a milder illness when they do have COVID-19. Let's talk about the New York City data first. Out of over 24,000 deaths in New York City, only about 14 of those were ages 0 to 19 years of age. In New York City, 85% of the deaths are from people ages 60 and older. In Italy, where over 200,000 people have been infected with COVID-19, only about 2% of the cases have involved children or teenagers. And out of 30,000 recorded deaths in Italy, only 2 of those are under the age of 19. 2 people out of 30,000 in Italy. In Austin, where I live, and the surrounding counties, there have been 93 reported deaths from COVID-19. Of those deaths, only 2 have been between the ages of 10 and 19 years of age. There have been no reported deaths of children under the age of 10 in my area. And the third reason we should open schools in the fall is that children are not likely to spread COVID-19 as easily as adults. There's been several interesting studies. Not one of them is a particular slam dunk, but the grouping of them together does raise some interesting questions and does give some validity for opening schools in the fall. Let me go through those studies with you. An author of a New England Journal of Medicine study in Icelandic countries stated that they did not see 1 case of a child infecting an adult. Another interesting report of the WHO China Joint Mission on Coronavirus Disease stated that after meticulous contact tracing, no one had recalled a transmission from 1 child to an adult. Most children contracted the illness from a known adult with COVID-19. In an article in the Journal of Clinical Infectious Diseases, there was a case study of a symptomatic COVID-19 child. He interacted with 172 people while symptomatic, and not one of those people went on to develop COVID-19. A quote from the European Center for Disease Prevention and Control states that child to adult transmission, quote, appears to be uncommon. And lastly, I know that parents are very worried about PMIS. That's the syndrome that we're seeing after COVID-19 in children. It stands for Pediatric Multi-Symptom Inflammatory Syndrome. I just want to reassure parents that this is very rare. As of May 13th, there are only about 100 cases in 14 states. Even fewer hospitalizations, and deaths are very, very rare. There's some good treatments for this syndrome, and I just want to provide reassurance to parents. We have over 56 million school-aged children in America, and I just don't think we have enough data to continue to keep those schools closed in the fall. Thanks again for joining me.